Colorado League of Women Voters caucus on a very important topic. It's a big word, depoliticization of public health. My name is Lee Thielen. I'm with the Larimer County League of Women Voters, and I'd like to thank the other folks from the Larimer County who have really helped pull all this together and encouraged us to do this, particularly Sue Tegman, Linda Mahan, and Elaine Bronford. So thank you. And Cameron, thank you for your expertise. We appreciate it. By the way, Cameron, I'm seeing you. I don't know if everybody else is seeing you or me.
I think we're seeing you.
Oh, good.
I see you.
Not that I want you to see me. I want you to see these wonderful panelists, which we're going to get to very, very quickly. So first of all, I want to say that this issue of depoliticization has really been magnified by the COVID-19 pandemic, but it's not a new issue. It's an issue that's been long-term, and it's been a challenge both locally and nationally. And before we get into the details here, I wanted to just have us all on the same page of what is public health. There's a saying we have in public health that helps with this, because public health is not the same as personal health care. And people often say, well, health care. No, it's public health. There's a little difference here. So the saying is, public health saved your life today. You just didn't know it. And what does that mean? Well, it means, one, you got up this morning and the water you used to brush your teeth was safe. You stepped out of the door and the air was clean. Your pipes weren't full and your paint full of lead. If you were in a restaurant this week, you didn't have to deal with secondhand smoke. You were not exposed to measles, polio, diphtheria, smallpox, and so forth. Public health is all about prevention, and it's all about the health of the community. Now, some of you may have seen some of the articles in the paper this year. They're awful articles, awful in the sense of the awful topic, about 19 Colorado public health officials being fired or forced to resign due to political pressure, usually from their county commissioners. You may have seen the spoof from the New York Times, and the spoof was an interesting one. It was based on, they call it the Fauci Awards, and that was what would we have if public health officials got awards instead of death threats? And one of our Colorado public health officials here on the panel was one of the three people featured. So yes, there are death threats to public health officials and their families. One public health worker in Colorado had her dog poisoned. It has not been pretty. By the way, our neighboring state, Kansas, is a good example of how this is a national problem. They have 100 public health agencies, and 1/3 of the directors were forced to leave. So this is a big issue. And before I introduce you to our panelists, I just want to read one little quote that I think helps frame this issue. And this is from the former CDC director, Dr. Tom Frieden. And he said, unless the politics are aligned, even the best designed and best managed public health programs will fail. Strong public health programs can be undermined by bad governance. This does emphasize the importance of promoting governance based on science and facts, openly and objectively derived. He also wrote, never in our lifetimes has there been as much controversy about public health action as there is now during the COVID pandemic. Now I'd like to introduce our three panelists, and they, to me, are all public health heroes. First, Dr. Mark Johnson. Dr. Mark Johnson is the president-elect of the Colorado Medical Society. For decades, he led the Jefferson County Department of Health as their executive director, and he continues to be their medical director. He's an important statewide leader in public health and has received many honors recognizing his work to keep our communities safe. He's led many public health organizations and now is in a unique position to create useful ties between healthcare and public health. Our second speaker will be Dr. Mark Wallace. Dr. Wallace served as the executive director for the Weld County Department of Public Health and Environment and is the current chief medical officer for Sunrise Community Health in Weld County. He was recently featured as one of the 3 public health doctors by the New York Times that have been heroes during this epidemic. He has not only been a strong and courageous public health leader, he has also championed health equity and access to care for many years. Finally, Representative Kathy Kipp will close out our panel. She serves as a House Representative for District 52 in Larimer County. She has long been a strong policy advocate for education and other important issues. In 2021, she quickly understood the challenges faced because of COVID-19 for the public health workforce and has become a formidable supporter for good public health decisions and actions. And so with that, I'd like to turn it over to Dr. Mark Johnson.
Thank you very much, Lee. And it's an honor to be here, although I must say I am a bit humbled and intimidated by seeing that Dr. Tom Vernon is on the in the gallery. He's the one who probably should be giving this talk. He is a past executive director of the Colorado Department of Health. I'm going to talk a little bit about the history of public health in Colorado and the politicization of public health for years and years, as Lee has mentioned. Back in 1944, as Colorado was planning for what was going to happen as all of the soldiers and servicemen were coming back from the war, Governor John Vivian put together a post-war planning committee, and one of the subcommittees was on health and public health. He chose an elderly woman, although she was my age, an elderly woman, Florence Sabin, to chair that committee. And as they began to look at the health in Colorado, they realized that most people felt that Colorado, based on its climate and its mountains, was a health mecca. And as they looked at the numbers of particularly infectious diseases and early deaths, they realized that that was not true in Colorado. Actually, Colorado had a reputation back east that when the produce from Colorado arrived in the markets, they had outbreaks of dysentery quite often because of the infectious material in the produce. But as they began to look at the situation, they were able to get a grant from the Commonwealth Foundation to have an American Public Health Association field staff member come to Colorado and do a health assessment or a public health assessment. His name was Dr. Carl Buck. And after spending about a year studying the health of Colorado, he came up with recommendations. And 4 of the first 5 recommendations that he made had to do with taking politics out of public health. Let me just read you a comment that is right before his first recommendation. The health of the people in any state is altogether too important to place it in state government in a position to be so completely susceptible to political machinations and maneuvering. Public health must be completely freed from political interference and permitted to develop and progress on a sound scientific basis. His first recommendation then was to take health out from under the direct overseeing of the governor. The second recommendation was to have a merit system for hiring qualified health workers instead of the system that they currently had at that time under the Civil Service Act. The third was to encourage local public health departments. The fourth was to have a nonpartisan, non-political state board of health. And the fifth was to have qualifications for the state health officer. Those qualifications included that they be a physician with public health experience. Those requirements have since then been taken off. We no longer, originally, the requirement for public health experience was taken off. And then in 1996, the qualification for a physician was taken off, so that right now, essentially the qualifications to be the state health officer is that you and the governor must be able to agree on a salary. If, however, the director of the state health department is no longer a physician, there is a requirement that there be a chief medical officer who is a physician and who has direct access to the governor when they feel there is something important. This report was taken by Florence Sabin and her committee, and they worked to put together what are known as the Sabin Health Laws, which were passed in 1946, 1947, which really established the first system of public health in Colorado. Florence Sabin went around the state lobbying for these bills, and what she did was she didn't particularly lobby with the legislators. She lobbied with the legislators' wives and talked to them about the health of their babies, about the health of the situations that their children were facing and was able to get most of the bills passed. In almost every talk she gave, she said her main job was to take politics out of health or health out of politics. That again, following on what Dr. Buck had said, health is too important to leave it to the whims and the machinations of elected officials. In 2008, under the leadership of Lee Thielen, we worked again on updating the situation of public health here in the state and put together what was called the revitalization of public health, requiring that every county in Colorado have an identified public health officer, or counties could join together to have a district with a public health officer. The essential public health services that were to be provided were identified. Qualifications for the public health officer were identified. And every 5 years, a community health assessment must be done and a community health improvement plan must be done to improve the local health or the public health at the local level. All of these then are taken up to the state level, which also has a requirement of putting together a community health improvement plan. That's pretty much the history of how we got to where we are right now. I believe that after the presentations, we'll have time for some questions and answers, and I look forward to answering any questions you may have at that time.
Thank you, Dr. Johnson. Our next speaker is Dr. Wallace. And Dr. Wallace, are you ready to go?
Yes, I am. I hope everybody can hear me. First of all, I want to thank the League of Women Voters for this opportunity to share what's happening, not only here in Colorado, but across the nation. And I have to tell you that I have been, in the time that I have been in public health in Colorado, the other Mark, Mark Johnson, is the real Mark. And I have been the other Mark, sort of following behind him and trying to live up to the standards of what public health in Colorado has been a leader in. And Lee Thielen and Representative Kipp, I appreciate so much the opportunity to share with you a very personal, boots on the ground experience that I've had to try and highlight the challenge that we have here in doing our role in protecting the health of the public. My training was primarily first as a family physician. And as I went through my training, I recognized that I was being trained very well in addressing the issues that were very medically related to the health of individuals, but that we were not being trained well in supporting the health of the population and protecting that at a broad level. So after I finished my residency in family medicine, I recognized very quickly that I needed to be trained in public health. And I am really privileged to have been able to complete the training in public health. And I want to share with you a little bit of my experience as a director of a local public health department, both as a physician that has a duty under my licensure and my training, but also what it was like to live through this COVID epidemic. What the COVID epidemic has revealed is nothing that is new. There are a lot of things that we have seen that have come out in the forefront in the epidemic that have been here for a long, long time. My day would begin where I had a duty to both individuals and my partners in the community and the population as a whole. Many of the places where I had to interface as both a clinician with knowledge of how this disease was spread, to the nuances of what it means to be a worker in a facility in which they're not able to distance people, where there are certain challenges to being able to maintain the business by providing personal protection, but yet where there are my hospital partners and my healthcare partners who have to see individuals who are presenting with very serious illness from COVID. So my day would start with, on the one hand, I would get a call from my hospital colleagues saying, Mark, do you recognize that we have 30-year-olds in our ICU who are intubated from a respiratory disease that is creating very critical illness in these individuals. And they are working in environments in which we believe they are not being protected. And then I would have to turn to that workplace in my role as somebody focused on a population and say, this is how my day started. I was briefed on the presence of individuals in the ICU who were intubated, who were 30 years old, who had said they feel in their admission history that their workplace might have affected their illness and their outcome. So I would then contact that business, which is important in our community. For those of you who know Weld County, you know we're very agriculturally based. We have many industries that are focused on that industry. And I would have to make contact with individuals to say, this is what I am hearing. This is my report this morning. This many individuals who work for you are hospitalized, who are intubated, who are struggling, who our healthcare system is wondering, where is public health in protecting these individuals? And then I'd have to work back and forth to attempt to provide that balance between supporting my healthcare colleagues who are focused on individuals and my obligation to the public to say that if we are aware of things that are affecting the spread of this disease around our community, that I have an obligation to make it known, to bring science and population health knowledge to this conversation, and to work to protect both sides of this. To say to my colleagues who are struggling to protect the people who are presenting to the emergency department, to say we are going to do our best to save them, for their families, for themselves, for the community, and to then turn to the companies, to the public, and say, this is something that affects all of us. And as we would unravel that investigation, as we would go into looking into, okay, what's contributing to this? What's happening? Where is this disease spreading? Why is it spreading? What is best practice to prevent spread? What do we know about this? And there would be so many interconnections that are beyond the domain of the care of individuals that present themselves back to us in public health and say that we must bring our science, our knowledge, our expertise, our commitment, our connections to solving this. And I would find that, oh my goodness, all of a sudden, some of these individuals over here are also potentially in congregate housing where they can easily spread this to somebody else. And somebody they don't even know that it is spread to is now going back out into the community and going to a nursing home because their obligation as somebody in a work release program says that they must have a job. And they're going and they're working in a nursing home. Now they are unintentionally spreading disease into that nursing facility, coming back to their congregate housing, being exposed to somebody who may be in another situation in which it is imperative that we find a way to prevent the spread in an industry that is challenged by people working closely together, by potentially not being able to easily do the preventive measures that we want. And we in public health are to step into all those spaces and to say, we have to be able to bring the best of our knowledge, of our science, of our experience to protecting the population as a whole, to working with corporations, to working with small businesses, to working with our public health partners who provide direct clinical care to people who are sick and suffering. And my job, which I took seriously as both a family physician and a proud public health official following in the steps of people like Mark Johnson, I took it seriously, but I'll tell you that I was caught multiple times in a political system in which my recommendations my best knowledge, my training, my commitment, my obligation was to all of those places, to the business that wanted to succeed, to the hospital that wanted to not have people being admitted and dying in the ICU from exposure to a communicable disease. And my job on the daily basis was to try and convince all of those partners of the wisdom of the collective science of what we knew from public health practice, from individual health practice, from nobody wanted any company in any way to fail because of this. But we had to intervene, and we had to do it in a way in which it was not subject to a lot of second judgment. We had to be able to bring, when I would go in, I'm primarily trained as a family physician. And one of the privileges of being trained as a physician in primary care is I could go into a room with the individual and I could close the door and all of the chatter was lost. I could give my best knowledge and experience in making a recommendation to an individual who was sitting right across the chair from me. And we could arrive at our best sense of what did that individual want, and based upon my recommendation. That whole model of trying to take that into the public sector was challenged in a way that I don't think served us well. I think we had to have a way in which we could bring forward the best of public health practice into our communities, into our businesses, into our healthcare providers, to protect the public as a whole. I felt many days when I went home, well, if I went home, I didn't always go home. Sometimes I didn't get to go home. But I felt an obligation to those people who were calling me from the hospitals and the intensive care units saying, Mark, we trust you. We respect you. We understand the knowledge you have. What can you do for us? How can you help us solve this as a community? And then when I would go back and try and bring those principles into, let me ramp this up into population health, that there was not an appreciation or an understanding or a system in which we could easily advance that at the level that I could in talking to my colleague who was caring for an intubated patient in the ICU. We have to find a way that public health and the public health officials who understand the science of population health can bring those best practices into our communities in the same way that I could, as an individual physician, bring that to patients in my exam room or in my intensive care unit. So I think we have a tremendous opportunity to look at how we can introduce this separation from politics into the work that we do in public health. I'm a proud public health practitioner. I'm now back in the world of practicing in primary care because it's a place that I could retire to and feel like I could make, that I could commit to making a difference. But I don't want to see more of my colleagues who I respect, who are so well trained in public health, lose the ability to do what I can do in an exam room today. I want that to be an opportunity for all of us when we focus on the population and our businesses and our communities and our families, to bring the best of public health in a way that is not subject to judgment based upon politics.
Thank you very much, Dr. Wallace. That was terrific, as was Dr. Johnson's. Is Representative Kipp still available?
Yes, I'm here.
Yay. We never know with the legislature, whether we have to adjust the program a little bit, but Kathy's here. Representative Kipp is here, ready to go.
Yeah, and so that's where we are tonight. We're in politics land, but I'll get to that a little bit later. First, I want to say thanks for this opportunity to talk to you all. And, I'm just really grateful for all of the public health people who have gotten us and persevered through this overly politicized atmosphere to get us where we are today, and at least having a vaccine in place that people have at least the option of taking, whether or not they choose to or not. But that's just so incredibly important. And so anything I can do to support our public health people is, that's what I'm here to do, right? We've got to protect everybody. I'm a former school board member for 7 years, and I've been in the legislature. This is my 3rd session. And so I guess one of the first things I want to take away as an elected official, I think it's important for everybody, including elected officials, to recognize that we are not the experts. Right? I'm a mile wide and I'm, an inch deep. I get a little bit deeper in some areas, but what I have to do as an elected official is understand enough about everything so that I can make good policy decisions, but I also have to know who to listen to and who to trust. And because I can't know everything, nobody can know everything. Although Mike Wiseman, who's a representative here, we call him Wiki Wiseman, he might come close to knowing everything. But, other than, those very occasional brilliant people, we really can't, it's just not possible. So where I got involved in this story is, basically, 3 things I'd say. First, during the pandemic, I was trying to read everything I could and share information about the pandemic with my constituents through my newsletters, because people were desperate for information, right? We were all like, well, what the heck is going on? And what should I be doing? And how do I get help? And how do I manage resources? I mean, we're still working on employment claims to this date with people who are having, issues just with that basic, living. We saw a lot of stories in the paper about the abuse of public health people. I saw Dr. Johnson's article that he did, article op-ed in the Colorado Sun, which talked about basically the story he just told you about how we need to keep politics separate from policy. And then Lee Thielen was generous enough to allow me to use part of her backyard, or her whole backyard, for part of my campaign kickoff, as we were going through the summer. And she had a lot of health people there. And they said, well, could you do this little thing for us? We'd really like to get this part of the legislation fixed so that we don't have just county commissioners who are making these public health decisions, because it's over politicizing the process and it's causing problems. I'm like, oh, well, okay, sure, that shouldn't be such a tough thing. Little did I know that I was going to face enormous pushback, because, well, let's start with county commissioners. Anytime you try and take away power from people who have it, even if they don't know they have it, once they realize that they do have it and that they might lose something, they push back, and they push back hard. And when you think about, there's 64 counties in Colorado, and every county has at least 3 county commissioners. Some have, more, depending on if they're home rule or whatever. That's a lot of people, and all of those county commissioners know their local electeds, right? All of us, we call ourselves electeds, or people call us their electeds. We all, we're a community in a ways, whether we're D's or R's, but we all have to talk. And so I quickly started getting messages from county commissioners saying, you need to get rid of this bill. I had one guy call up and he's like, I live in Northeast Colorado. And he yelled at me on the phone for 3 minutes with, which was my message. I didn't pick up the phone. And then I went on to my next message and realized that he'd called me back and told me where I could shove my bill. So, right, there's this really interesting atmosphere when it comes to depoliticization, but it actually goes back further than that, because I remember when I was on the school board and I would come down to the Capitol to lobby for education or whatever. I remember seeing Representative Janal, who's now Senator Janal, in the stairwell, and she's like, oh my gosh, it's just so crazy around here. We're running this vaccination bill, and every time a vaccination bill came up in the Capitol, there would be all of this, everything around it, all of these people who have an alternate universe of facts, or if you want to call them facts, misinformation, who are in the Capitol. And they're really very poorly behaved. I mean, they actually harass our nonpartisan staff, which is unacceptable. I mean, fine, I'm a politician, I signed up for it, harass me, that's what you do. But really, you're gonna harass our nonpartisan staff, you're gonna call every number and bother every person, and because you don't think you're being heard and you think that your misinformation is correct, it's just a really, in my opinion, horrible place to be. So there have been several vaccination bills over the year. One of my colleagues ran a bill in 2019, which, what happened? I think there was a deal made at the end of session. My colleague got death threats over this bill, and he had a sheriff sitting, or a police officer sitting in front of his house. He has a wife and 3 little kids, right? And he's an emergency room nurse. He's a public person, and he's a medical person, and it's just unconscionable. So finally, last year, actually, yeah, they ran the bill again during the pandemic. Well, before the pandemic, and then it lasted through the pandemic. I actually got to sit in on that hearing, and it was the wildest thing. I got to sub in for somebody who's like, I do not want to be in a room with all of these people who might get me ill. So those of us who were willing to do it did it, and it was just, I'm going to describe it to you because it was just the most surreal experience. So we're in this hearing room on the 2nd floor of the Capitol. It's a large room. They gave the opponents or the proponents, or the opponents, I guess they gave them like what, 2 hours of testimony, and then they had the proponents come in to do 2 hours of testimony. So all of we realized this is June of last year, and it was on a Sunday. I think we did it on a Sunday because we wanted to have the minimal number of people in the Capitol, because we were all terrified that all of these people who don't believe in vaccinations were in the Capitol and going nuts. So anyways, all these people came in, and they, all of the unvaccinated, the anti-vax people were unmasked. It's like those two things go together. And they were having a rally right outside the window of where we were. And they were all quiet for the testimony of the people who were on their side of the bill. And then the proponents came in. They tried to stage a sit-in, then they started chanting outside the chamber, and they sat on indoors and outdoors, and we're like, what do we do here, right? And it's like, you can't stop it because they'll just keep going. So we just persisted, but it was the most bizarre, surreal atmosphere ever. So I'm just saying, there's that end of the politics, and then there's the people giving up power part of the politics, and it all sort of ends up merging together, not to mention the whole national story of misinformation coming down from the very highest level. So what ended up happening with my bill, it started with saying, well, county commissioners can't serve as public boards of health. And we went through a lot of iterations of the bill. Where the bill ended up was a long ways from there, which was, we said, we could go ahead and let the bill die as we wanted it and let it be a strong bill in its death, or we could try and take a step forward. So what we ended up doing is we ended up at a place that said, we are going to say that all members of public health boards have to get trained annually, receive a public health training annually, and a public safety training annually. So any members of local public health boards or the state public health board. It was a long ways in between. It was rather painful and time consuming, and it was quite a story to get there, but I think that you guys need to have time to ask questions. So I'm not going to go into all the details, but if anybody wants to come to one of my, informal Zoom chats sometime, feel free to stop by, and happy to take you through the whole story if you really care. But it was just really quite an odyssey of and an understanding. But on the other hand, I just want to say one more thing. I have a couple of colleagues in the Senate who well, we have some ideas. And it's like, well, okay, I have an idea. So, it's not like we make all of our progress all at once, but sometimes you tiptoe along and you make a little bit of progress at a time. And sometimes the best bills are the ones that fly under the radar and nobody really notices. So, we can hope for that next time.
Thank you so much, Representative Kipp. One thing I learned watching this bill's progress is that Representative Kipp really understands strategy. She counts her votes. She knows what'll fly and what won't, and she doesn't give up. And we have a bill that hopefully the governor will sign and will start to make a difference in its own way. And we're pleased with that, very pleased with that. I'd like to open it up for questions. And I think Sue Tagman, you were going to help me with managing these questions, I think.
Yes, I am. And so between Lee and I will monitor. You can raise your hand with the digital reaction button. It's under at the menu option at the bottom on the right. You should have a button that says reactions, and that's where the raise hand is. That's probably the easiest way to find us, or us to find you actually. Or you can put it in chat if you've got a question. I'll read your questions there. So who wants to get us started? Let's see. Yes, Marianne.
I'm in the Boulder League's Money in Politics issue team, and this, I had not honestly given any thought to this. I'm often thinking about other things. Have you been able to do any tracking of the sources, who's funding, how much of it is politics, how much of it is industry that's behind the death threats? Is there any systematic study of the sources of the opposition to public health? Who's funding? Who are the different funders of the... I've developed a very cynical attitude. Sorry, it comes with the technical.
I don't know, maybe one of the Marks has doctors has a better answer than I do, but there are people who, it's just part of the world of conspiracy theories, I think. I mean, I know that some people believe that there's, Russian trolls out there spreading anti-vax stuff too, and that undermining public health certainly undermines our country. Absolutely. So, I mean, I don't know how much of that is true, but it's just the world of conspiracy theories that really undermine what we're all trying to. Do you guys have a better answer than that?
I'll take a stab at it. I think it differs depending on what county you are in and probably what state you are in. But as Dr. Wallace mentioned, he had a major issue with a particular business or a group up there, commercial group. And so he probably got most of his concerns from folks around that business. In Jefferson County, where I worked, we had a large, since he was so confidential about what the name of the company was, we had a large speedway that we closed down, and we had numerous fans of the family and the speedway sending death threats in our direction. So I think for the most part, it had to do what was going on in your particular county, but then overall, this, every pandemic becomes political to some degree, but in this case, this is the most politicized pandemic I think our country has ever seen, mainly because at the very highest levels of government, it became very political very quick. And so it depended on which party you were in, and that is sort of where the complaints or the nasty telegrams or nasty emails and phone calls and death threats were coming from. So it's hard to say exactly who was funding it. It seemed to be more ideological and political than on the large scale than it was really money being put into it.
Hi, this is Lee, and I'd also say that I think certain parts of our media were fueling a lot of this as well. And again, I won't mention that which will not be mentioned, but there are at least one or two networks, but also, of course, all the websites that are getting a lot of followers, shall we say, on these conspiracy theories and on questioning judgment of government. It's a lot of it is distrust of government. Take public health being seen as government that's telling you what to do, and you can't put up with that. I'll stop.
And I would add, I was trying to walk all sides of this. So a third of my funding as an agency came from local sources, local taxes. A third came from state and public, and a third came from fees that we charged. So I knew where my funding came from. But on the one hand, I was trying to be responsive to information that I was getting from my clinical colleagues who were dealing with individuals. That was their job. Their job was to deal with individuals. That's what healthcare does. Healthcare deals with individuals. And when individuals are coming in with COVID and serious infections from COVID, and in their intake, what we do as physicians in that situation is we take a history and we ask you all sorts of questions to try and pinpoint what's going on, how could this have happened? And then you try and come over into industry in a way where one of the most disappointing things for me was I know that in my community that I was serving, that one of the things I had to be certain of is that balance between protecting industry, which provided jobs and opportunities for people to be successful. But on the other hand, I was trying to bring the best knowledge and science and practice we had in preventing the spread of a respiratory illness that could take down a company and take down a community. And that balance, that back and forth, that's part of what we do in public health. We have to go back and forth between the population level, the company level, the individual level, and the political level. And we are constantly trying to go back and forth. I have to be able to bring to bear into that conversation and that practice the best science we have. I mean, at times it was very hard. It was very hard to get in there and say, I'm actually trying to do for the business what you want. You want healthy workers. I want healthy workers. My hospital wants healthy workers. My politicians want healthy workers. But we don't have a path to make that easy to get to. We share a common interest. We want healthy workers. We want people to be successful and independent, and for me, that was the part that I learned, and I tried to look to my colleagues in both public health, in politics, and in private practice about how do you knit that together? How do you knit that together? We have to be able to say that there is a science to this. There is an information base that says this is the best practice to go forward. And here's how we balance all of that. And it became very hard because we were in an environment in which it became very politicized, which created barriers to what we normally would have been able to accomplish. And in this situation, it revealed things that we couldn't get beyond. And it was, while I might not have personally received any death threats, there were people who thought I was opposed to the community, to businesses, to individuals, that I was going to, and that just wasn't true. I mean, there's a truth to this. We knew how this illness spreads. It spreads respiratorily between people in close proximity to one another. And I couldn't do my job. I couldn't do my job on any of the fronts. I couldn't do my job to deliver what my government wanted. I couldn't do my job to deliver what the businesses wanted. I couldn't do my job to deliver what the unions wanted. It represented the workers. I couldn't do my job to do what the healthcare providers wanted and desperately needed. And I couldn't do what my obligation was to the population, which was to protect them from the spread of this disease.
Thank you. Thank you for your question, Marianne, and for the very thought-provoking responses from each person. We've got another question from Linda Mahan. She asks, how can we as interested citizens try to educate Colorado residents about the important issue of depoliticizing public health from politics? Who would like to get us going on that one?
I'm going to start a little bit with that because what we didn't make real clear with our discussion so far is that the way the law in Colorado is written right now, if your county has a population under 100,000 and you do not already have an independent Board of Health, that the county commissioners can be the Board of Health. Now, that doesn't affect a Larimer County, a Boulder County, a Jefferson County, where there are independent boards of health. But it does affect many, many of our counties, and those are some of the counties where we lost people in public health this past year. And one of the things that we were kind of surprised to hear from county commissioners when they were opposing this vehemently to Representative Kipp and the other sponsors was, we don't have qualified people in our county to be on the Board of Health. What? What are the qualifications for being a commissioner? Be 18 years old and have lived in your county for a year. But somehow they were qualified to be the Board of Health. And they weren't, I think they were disrespecting their own constituencies by saying there weren't people in their counties that would be qualified to be on the Board of Health. So I think one of the things that, you know, as citizens, the conversation we need to get going statewide is for the citizens themselves to understand that their county would be better off with an independent Board of Health. And we have evidence of it as well, and I can talk about that later, but I'm going to stop right there and let other people speak.
And I'll just add in, you know, it was really interesting going through this because I started to get people from around the state calling me and they'd say, oh my gosh, that my county commissioners are my Board of Health and they've just said that we should not wear masks anymore, right in the middle of some of the biggest peaks that we've had. It's like some of the county commissioners didn't even know they were boards of health, but they still didn't want to give it up. It was just extremely bizarre. And so I think that was one of the things that we want to make sure that we get out there. Maybe we need to figure out a way to do this, but make sure that people understand that if they did have an independent Board of Health, like Lee says, there are qualified people. People would reach out to me and say, hey, I'm a doctor, I'm a retired doctor, and I was hoping that if your bill passed, I could serve on the Board of Health. So, and I think from my perspective, just give people good advice and tell them they should listen to their public health experts and do things like get vaccinated. Because I will tell you, there was a bill in the Capitol just last week called, what was it? The freedom of choice from vaccines or whatever. Basically, it was the don't tell us what to do. Don't tell us we have to have a vaccine passport. It should all be about personal choice. And I listened in on part of that hearing. The amount of misinformation that people are putting out there. So I think the best thing you can do is to give people good information and give them some idea of who the people are they can trust.
I would just say that I actually think the biggest problem about having county commissioners be the boards of health has not been during the pandemic, but was actually before the pandemic. We have had numerous public health nurses and public health directors from small counties saying that they could not get the attention of the boards of health when they had issues around things like vaccination or chronic disease or communicable disease or on-site wastewater systems or other things that are not terribly exciting to deal with, but a lot of them were having problems with. And as Representative Kipp said, some of the boards of county commissioners didn't even realize they were boards of health and were not interested in dealing with the issues. The pandemic became popular, I guess is a bad word for it, but it became something that was interesting to be dealing with from a political point of view, as well as because of the public health orders that were being put in place, both at the state level and the local level, were causing a lot of controversy. And so they were interested in getting involved, and a lot of money came into the state and to a lot of the health departments because of the pandemic. And so I think the interest that the county commissioners had to do some with the money, some with the politics, some with the power that was going on. But the real need for a qualified Board of Health was also there before the pandemic and was not there for many of the local public health directors when they were really seeking out advice from a qualified Board of Health.
Hello, this is not Mary. This is John. And I would like to make a comment. I'm in Grand County. And one of the things that that we did is a group of us who were very concerned. As you know, Grand County lost our head of public health. Wasn't fired, but it made it so difficult that she had to end up leaving. And we were concerned about that. The mask wearing in the county was kind of an interesting, bit of a disjointed issue. And so we started listening into Board of County Commissioner meetings, which up here are every Tuesday morning and early afternoon. And then from that, it kind of goes to the question of how do we educate ourselves and educate others? So the group continued to expand, and we have 13 people. One of the things we wanted to do is show the commissioners, try to prevent them using the excuse that there aren't any qualified people. And so we have a group that includes 4 doctors, a judge, 4 or 5 RNs, a dentist, EMTs. And so there's no question that there are qualified people. And fortunately, we put together a proposal. And by the way, Kathy Kipp was very helpful to us. Dr. Johnson was very helpful to us in referring us to some folks who helped us move this along. Anyway, bottom line is we did present to the county commissioners last Tuesday. And one of the things we did is we had 13 people on hand at that meeting, which I think was a message. We wanted to send a message to them. And they knew many of the people in that room, that there are 13 people. Now what we're doing is taking the proposal and going out to organizations, realtor groups, and so on, and such, and chambers of commerce to get the message out there. And our message is about an independent Board of Health in Grand County. It's not so much about public health, but one of the things I've gotten already from this and listening to the Marks, especially, is we probably need to spend a little. We're going to have a workshop, a public workshop. And so we need to, I don't think, go into huge depth, but we have an opportunity, hopefully, to talk to people about why public health is so important. And I love some of the things that I think it was Lee said, you know, you didn't die today because of good public health and so on. So I appreciate all of that and wish us luck. We're moving forward to the next step, and the workshop will be that next step. And we're hoping to, in my mind, I'm hoping that we can get 100 to 140 citizens out there listening to this. And I do want to say one other thing. I'm probably going to be bugging off here in a couple of minutes. I have a brother and sister-in-law haven't seen in many years coming to town shortly. So anyway, so thank you all. Kathy and Mark, you've all been helpful to us.
Thank you for your comments and your efforts. We've got one question from Ann Sudden, and then I think we'll take it to a closing question. So we've got about 6 minutes remaining here.
Yeah, I don't really have a question, but I have a slightly different comment from what we've been talking about. And I see that Linda Mann actually has probably answered what my question was going to be, which is I saw that Larimer League had made a proposal for a position for action in our action book on public health.
Mm-hmm.
And it wasn't exactly denied, but it didn't exactly get a rousing round of applause. I would very greatly encourage this. I am a public health professional, but not boots on the ground like you all are. I am a regulatory specialist in biopharmaceuticals and regulation of public health at the federal level. And I saw, as I watched the COVID pandemic unfold, I was absolutely appalled and disturbed by the leadership or lack thereof at the federal level. So that's one of the things. The other thing is that I'm on the LAC committee, and I worked on both the legislation to import prescription drugs from Canada, which was successful, and the legislation for school entry immunization, which was ultimately, finally successful. And when I was working on those two bills, I really couldn't find a position in the position book that gave me league support. I got LAC support, but I kind of had to make it up as I was going along. We need some real up-to-date, modern, science-based language that talks about the value of public health. And Lee's description of what public health is was excellent. That's what we need in our position statement. I would be delighted to work on that committee.
Thank you for that. We may reach out to you, Anne. Appreciate the comment. You got some enthusiastic response as a result of that. Linda Rosa has, she had a question in the chat and has her hand up. So we'll briefly go to you and then a closing question, Linda.
Oh, okay. I'm in Larimer County here, and we have a lot of pseudoscientific nonsense going around about the COVID vaccine and alternatives. You know, big meetings at churches, the hosted by homeopaths who claim you can boost your immune system and you don't need the vaccine, which is, you know, got all sorts of chips and things in it. Anyway, over the years, I found it very disappointing that legislators talking about politics are allowing a lot of these pseudoscientific practitioners to practice legally in Colorado, giving the imprimatur of the state to their positions. And these are people like these naturopaths are people that don't believe in germ theory. They recommend often against getting vaccines, and the COVID vaccine. I've been seeing this and recommending things like homeopathics. And I made a complaint against one guy who gives IV hydrochloric acid to prevent COVID. So why do we have this sort of mixed message from legislators that it's okay for these guys to practice, yet they running counter to science-based public health measures? And I'd like to thank Dr. Mark Johnson for so many times coming to the legislature and testifying against these bills.
Let me just address that briefly. So what happens is the Department of Regulatory Affairs is tasked with coming up with recommendations on a regular basis. Most of these fall under sunset provisions. And so and then there are people who put bills through the legislature to make sure that certain things are licensed. For instance, genetic counselors were something that said, well, you know what, we don't want it just to be like 23andMe being, telling people what to do and taking advice from that. We want an actual, genetic counselor. So there are efforts to do it. That particular genetic counseling bill did get vetoed by the governor. It made it all the way through the legislature. So it's really a push and pull of what's licensed, what's certified, and the various levels. And it's a complicated web, but yeah, no, you're right. We should do a better job of making sure that people have some kind of licensure and certification. And I know that, there's push and pull. There's people who work on it, and there's people who are like, oh, we don't need all that regulation. So that's where we are.
We have inadequate regulation. We have naturopaths regulating naturopaths, and we have lay midwives regulating lay midwives and allowing them to get away with this sky high perinatal mortality rate. So it's not a system that works at all.
Thank you, Linda. Dr. Johnson, did you want to comment on that as well? I saw you come off mute.
Well, I was going to. Hello, Linda. Linda and I have worked together for at least 30 years on bills like this, and the problem is in politics and in policy, it is not always easy to find an agreement as to who is the authority. And quite often it is the political pressure that a group can put on their elected officials more than it is the righteousness of their cause that leads to bills. And it's not always just the legislature. It also, we have found that the directors of certain departments or councils or certification programs also seem to have an axe to grind. And it would be nice if everybody could turn to an authoritative group or a group of real authorities and come to an answer. But in a society like we have, I don't think we are ever going to get to that position where everybody agrees, okay, let's ask the doctors, or everybody agrees, let's turn to the scientists. We already see that very clearly here in this pandemic.
Thank you, Dr. Johnson. Dr. Wallace, did you have a comment as well? I saw you come off mute earlier.
No, I appreciate everything that people are saying, and in the interest of time, I won't make any additional comment.
Okay, thank you. Lee, I'd like to come back to you, and I do want to thank Lee. It's because of Lee that we're here tonight. She is the one that initially suggested we do something in the area of public health, and we morphed from wanting to create a position to doing some educational outreach. And so we envisioned this just being the beginning. And so Lee, back to you, and one of the key questions that maybe we can wrap up with is, what's the call to action for the League of Women Voters?
Well, you know, I think a lot has to do with using the process that the League has to have a very clear statement about the value of public health and the importance of separating public health decisions from political pressures. Mm-hmm. And I'm not sure exactly how we might go about getting there. I think Linda Mahan has put up something about, we would like to do a webinar to take this issue a little further. I was so pleased to hear what's happening in Grand County. That just inspires all of us. And thank you for all the work that's being done there. And we talk about science and evidence. And we had, for the School of Public Health, Dr. Glenn Mays, who's an expert on public health infrastructure, did a research for us on this topic, came up with 5 key findings about what happens when you have an independent board of health. I'm just going to go through those real fast. Your agency is more likely to meet national standards. You're more likely to have public-private partnerships. You're going to have significantly higher financial resources and performance. You will have significantly lower levels of premature mortality. And, you know, who can argue with that, really? If all of these things come about because public health interests are separated from political pressures, let's have the citizens say, we want better health in our community. I'm going to stop right there. I guess we should just thank everyone. We've reached our time limit, and I think this has been great fun and very enlightening, and so pleased that we had Dr. Johnson, Dr. Wallace, and Representative Kipp. You truly are the ones that we're going to keep turning to. So,
and it looks like Fran is waving her hand. Fran?
Thank you. Thank you.
Yes.
I'm a former state representative, Fran Coleman. I served from 1999 to 2006. And regarding the question about the naturopathic health and stuff, you're correct that issue has come up as long as I can remember, the entire time I was in the legislature and since. The one thing we need to remember is that it is a citizen legislature, and Representative Kipp is correct, is the amount of things that you have to address are a mile wide, and your knowledge becomes an inch thick. So that's the biggest thing, is that when you know legislation's coming through, that is making sure that we're there and advocating for or against something, because that's the only way it gets turned around. Thank you.
Thank you.
I guess we should just call it to a close. We're past our time. Thank you, everyone, for participating. This has been, I think, a really, really good discussion. And I hope the beginning of much more that will happen through the league on regarding public health.
Thank you, Lee. This was great. Thank you. Thank you.
Thank you, Joyce. Nice to see you. Good night, everyone.
Good night.
Good night. Thank you very much.